Hey, good afternoon, class. So for this assignment, I've chosen the push-up test. This field assessment is a measure of local muscular endurance, primarily the upper body, focusing on prime movers such as fibers of the pectoralis major, anterior deltoids, and triceps. Muscles of the core and the lower extremities are providing stability as they're actively engaged in isometric contraction. This assessment is appropriate to perform for any individual or athlete who would benefit from having their upper body musculature endurance measured to categorize their fitness level or project athletic performance. Regarding communication strategies, test procedures should be thoroughly explained to the subject. Demonstration can be provided if necessary. Any precautions or contraindications to the nature of the activity should be discussed, including any acute injuries, fractures, inflammation, surgery. The subject should be educated on what to expect during the test, such as experiencing significant burning, which would be indicative of fatigue onset. It should be ensured that the subject exhibits appropriate breathing patterns and is monitored for adverse effects to physical activity as well. Now, there are two variations to the push-up test. We have the Army standard and the American College of Sports Medicine standard, herein referred to as the ACSM standard. So for this procedure, we'll be focusing on the Army standard. Please refer to the write-up in our discussions for testing variation details. The only equipment you will need, primarily for the Army standard, is a timer. So the subject should start in a standard push-up position. As such, hands should be placed about shoulder width apart. All right, there's your front view. Lateral view here. Starting position for this test, okay? One repetition is counted for this test when the upper arms reach parallel to the surface they're on. So up position, push up low position, right? Back to up position. The Army standards define the push-up low position, as mentioned, is when the upper arms are parallel to the floor. The subject is instructed to perform as many repetitions as possible in a time frame of 2 minutes. The athlete is only allowed to pause in the up position and must maintain the up position while resting, not collapsing to the knees to rest. Only full repetitions are counted, and the test is terminated if the patient drops to their knees.